Congresswoman and the senator said I was the point person, but the truth is, when the president talked to me about taking this job, he said I was going to be his point guard. I don't know. I guess I need to gain a few inches here. Maybe with the senator's help and the congresswoman's help I can do that. But I am thrilled to be here in Connecticut. Connecticut is in many ways at the center of this debate about how do we get affordable health care for all Americans. How do we get that done in this country? And I was sitting here thinking, in so many ways you are at the center. We're here at this hospital, Griffin+Hospital, which has been a leader nationwide and frankly internationally in how to deliver truly patient-centered care. And I think it says so much that you've won the award for being a great place to work. I, as a consumer, know that when I go into a place to get health care, I want to go to a place where clinicians and everyone who works here feels good about what they're doing, and I can just tell from the people sitting in the audience that they do, so you're to be congratulated for that. And that's what we need to try to do nationwide. You also have some leaders in the corporate world here. Last week at the White House, the president had Pitney Bowes in the Roosevelt Room among a very small group of companies that he was talking to about how do we do more in this country to bend the curve in healthcare costs. And one way we do that is through workplace prevention and wellness, through truly investing in our workers and in ourselves and making sure that we prevent disease and treat it when it's less costly and keep people well. And so we have well care instead of sick care. And Pitney Bowes is a place where they know how to do that. They've been doing it for years. So we're trying to learn from them in Washington. We're also making a huge effort to get all the healthcare records and clinical information in a way that they can be used more readily and prevent errors and help clinicians to provide better care. And that effort is being led by someone from up here who's related to someone sitting over here in the first row, your Attorney General, Blumenthal, Richard Blumenthal. His brother David Blumenthal is a doctor who is leading that effort for President Obama. And then, of course, we have a lot of what's going on in Washington, and our ability to be successful with healthcare reform this year depends quite critically on the two people sitting over here to my left. Congresswoman DeLauro, who has been not only a friend of mine, a friend of the administration's, but also a leader in women's health care and a leading voice in the House, and will be someone who is instrumental in getting this done this year. And then I have to just say a few words about Senator Dodd. He is not only a leader in health care, but he is a leader on behalf of children. And I happen to know, Senator, that it's baby day here at Griffin+Hospital. I couldn't miss that coming in, and I mean, he never misses a chance to let us know that these children are not just little adults, that we have to make sure that we take care of them especially well in whatever healthcare reform bill passes. He brings that up every time. But he's a leader not just on healthcare. He's someone who President Obama trusts. He trusts his judgment, he trusts his experience, he trusts his practical skills and his know-how about how to thread the needle, how to get something done in the United States Senate, how to forge a new foundation for healthcare in this country that can last with a practical approach, and an approach that I think is informed by the democratic effort that we see here today. And so when the president, every time I run into the president, which is quite frequently, because we're always doing a healthcare event at the White House, he says to me, I want you to feel pressure. I want you to feel pressure because I want to get this done this year. And I do feel pressure, but I'm not worried about it because I know we have Senator Dodd there leading the effort in the Senate. Now I'm putting pressure on no, it's true. I know that we have him there leading the effort in the Senate, leading the Help Committee, and that they're going to get it done. They brought everyone to the table. They're listening to all points of view. They're working in a bipartisan way to forge an agreement that will ensure health care that lowers costs for everybody and also gets everyone covered. That's what we need to do. So it's really great for me to be here. I was thrilled to come, and I appreciate the support that you all have shown for Congresswoman DeLauro and Senator Dodd, because they're going to be key to getting this done for the president this year. As he said, health reform cannot wait, must not wait, and will not wait another year. So we look forward to hearing from you about how to do it. Thanks.